Yeah. Good afternoon, doctor, and to the general public. Today I will give you a presentation of the article Virus and the Risk of Lung Cancer Prevention and Treatment. In the introduction, we have the tobacco smoking is the main risk factor for lung cancer. Other risk factors include exposure to asbestos, household use of biomass fuel, environmental pollution, genetic factors, and chronic disease. For example, the COPD, asthma, bronchiectasis, emphysema, and HIV. Infectious risk factors, such as mycobacterial infection, previous pneumonia, and Chaladomophila pneumoniae infection have also been reported and investigated. The lung cancer in Europe in 2020, a total of 318,327 new cases of lung cancer were estimated to be diagnosed in the 27 countries of the European Union. Overall, 64% of cases were diagnosed in men and 36% in women. People aged 45 and 69 years had the most reported new cases, followed by people aged more than 7 years old and people aged 20 or 44 years. The lifetime risk of developing lung cancer in people aged 0 to 74 years is 1 in 19 in men and 1 in 37 in women. In the picture, we have the estimate incidence of lung cancer in Europe in 2020 by sex and country. In the other, have a total of 257,293 people died from lung cancer in 2020. 66% of them were male and 34% female. Lung cancer is the first cause of death due to cancer in men and the second in women, both in Europe and worldwide. In the picture, we have the estimate of mortality from lung cancer in Europe in 2020 by sex and country. In the virus and their relationship with lung cancer, the main infectious agents related to cancer were Helicobacter pylori, HPV, Asir, hepatitis B, virus, and hepatitis C. Industrially, EBY, HPV, HCV, and HBV, as previously been shown to be one of the 4 major cancer-associated viruses. Smoking has a potential role in increasing the susceptibility of lung tissue to viral infection, in addition to affecting the function of oncoproteins. In the picture, we have the viral oncogenes and synergies with tobacco smoking in lung cancer development. Okay, in this picture, we have the virus related to lung cancer and proposed mechanisms of oncogenes. In the virus, we have the HPV. The potential mechanism of oncogenesis lung cancer, E6 and E7 proteins starch P53, BCL2, and NERV, disrupting the cell cycle and apoptosis. In the level of epidemiological evidence, in the HPV, we have the high HPV genome found in tumor genome meta-analysis, indicating greater risk of lung cancer in HPV positive subjects. In the EVV, the potential mechanism of oncogenes, the model of oncogenes suggests previous premalignant lesions, type 2, latency and activity of AVNN, NI, LMP1, LMP2, and other EVV proteins led to tumor promotion. In the level of epidemiological evidence in EVV, we have the high meta-analysis indicating high risks of lung cancer in EVV patients, EVV genome in lung cancer tissue in vitro models. The HIV, we have the immunosuppression favor tumor immune escape, and we have the high meta-analysis indicating HIV patients have greater risks of lung cancer to 5-fold increase in the risk of lung cancer in PLWH who smoke. In the CMV, we have the pool 1 to 3, pool 1 to 2, another CMV proteins induce entry to S phase and cell cycle deregulation. In the level, we have a low CMV genome found in lung cancer cells, oncogenic transformation of human embryo lung cells, and in the MV, we have the inhibition of PIRH2 ubiquitination by the MV photoprotein leading to negative regulation of P5B3. In the level, we have the low expression of MV protein in NSCLC. In the prevention and treatment of oncogenic viruses, we have the prevention of infection by oncogenic viruses in complicated signs, with the exception of HPV. There are no approved vaccines for the viral agents described in the previous section. There are some strategies to avoid viral activation. In EBV infection, smoking should be stopped and recommended for a smoker has a primary upper respiratory tract prevention measure. And currently, there are several phase 3 clinical trials evaluating drugs that activate the lytic phase of EBV. For example, the CDDP, 5-fluorouracil, gentamicin, or EBV vaccines. In the COVID-19 and lung cancer, the future challenge of research, a letter recently published by Kelly has summarized the possible oncogenic effects mechanisms of SARS-CoV-2 in the development of lung cancer, possible damage from virus to the lung causing pulmonary fibrosis, the hyperinflammation that patients frequently suffer with severe COVID-19, and down regulation of angiotensin converting enzyme 2 could be involved in the possible development of lung cancer. There are few studies of the short and long-term consequence of a serious infection. A global, scientific, and public health effort is required to continue investigations and trying to prevent possible development of lung cancer due to SARS-CoV-2 infection. In conclusion, we have the role of viruses in lung cancer development remains unclear, but is supported by epidemiological data of infection in tumor cells. Also, basic research studies have shown potential oncogenic mechanisms of viruses in lung cancer cell lines. Further research is needed. Tobacco smoking can contribute to viral oncogenesis by producing local immunosuppression and increasing viral pathogenesis. Thanks for your attention.